Workers are bracing for another type of impact. They are anticipating a steep rise in what you might call the diseases of isolation, and that includes suicides, opioid and drug abuse, domestic violence, and depression. And they say it will start happening in the next few months and could stretch on for years. Now, before you say, that's not me, you might want to think again. Dominic Miller is joining us from Southwest Behavioral Health Services. Dominic, this pandemic is impacting everyone and in so many different ways. I think so many of us are feeling our mental health be tested right now. Good morning to you.
Good morning. How are you?
I'm doing okay, and I feel like okay is success right now.
I agree.
Tell me about this is going to really impact the healthcare system, and we're bracing for a tidal wave.
Absolutely. So, mental health is one of those issues that sometimes gets pushed to the wayside when thinking about something like a pandemic. We give a lot of attention to the frontline workers, and we should, but us mental health workers are bracing for what you said, an impact that might be coming soon. We know that social isolation is a risk factor for increase of substance use, especially in Arizona, where we have an opioid epidemic happening alongside the pandemic. So I just wanted to highlight that as well.
We're also talking about suicides, unemployment, that isolation, and really minimal places to turn. Our usual avenues that we use to de-stress are closed right now.
Correct. A recent poll by the Kaiser Family Foundation said that 54% of adults in America are reporting a negative mental health impact due to job loss or loss of income. And so that it directly impacts the work that we do, where we're talking about these issues with our patients and making sure that we're providing the support that's needed for them to just get through the season or even the day.
All right, Dominic, school us here. What do you want the people to know on how to get through this time?
I think the term social distancing is a little hard for us mental health workers. I think we prefer physical distancing because you don't want to socially disconnect with anybody in your support system right now. I think it's very important to find ways to connect with folks. I know that Zoom exhaustion or virtual exhaustion is a thing.
Yeah.
And I get that, but don't throw away your support system. And I think it's extremely important to stay connected in this time.
Okay, how do we tell if we might be on that tightrope about to slip off?
I think it's kind of a matter of just checking in with yourself. Are you more irritable? Is it harder to get out of bed every morning? Are there temptations to maybe use more substances than you're usually using for recreation, for example? Those kinds of telltale signs might be, time to reach out to somebody for help, whether that's a friend or even a professional.
The pandemic margaritas to go were fun in the beginning, but this thing might be lasting longer than we thought. So time to back off of that and really get back to our healthier selves. Any last words for us? I know we all need to hear something to keep us in a good place on this Sunday morning.
Absolutely. Well, I would encourage everybody to reach out for help, even if you feel, it's the beginning of maybe a decline in your own mental health. I would encourage you to look for the support system. Southwest Behavioral and Health Services, our doors are open virtually, and our sites are open as well for support to the community. 211 is a great resource for free crisis COVID-19 counseling. And of course, the crisis line is available, which I'll provide to you, Jamie, after the segment.
Awesome. Dominic, thank you so much. We appreciate you. Stay well, my friend, and stay well to you.